For years, I feel like the main topic of interest for fat transfer was to the buttocks, but now it's shifted. And now more and more patients are asking about it for the breasts. It's something that we've done actually for many, many years. And it was super common to use during reconstruction, where we'd add fat around an implant in a patient that had a mastectomy where there really is no breast tissue. But for the same reason, it could help an implant in that patient, where it would help look softer and hide the contours of an implant. That applies to aesthetic patients as well. So if it's more obvious that someone has an implant, we're trying to soften that look or trying to increase the volume in a very specific location. Fat transfer is amazing for that. So say, for example, someone has cleavage that they feel like is overly wide after their implants go in. A lot of time that's related to how their anatomy was to begin with. It's just the way their breast naturally sat. But by increasing the size of the implant, that doesn't necessarily change. And yes, we can do kind of internal maneuvers where we're closing down that pocket or doing an internal bra and trying to get it to sit differently. But another great option or alternative is we add fat towards where the cleavage is, because then it's giving that softness and fullness where you really want to see it the most. Other patients, they don't want implants. They either only want to augment volume to a small amount with fat, or they want to add it a little bit when they're doing the lift. Both of those are reasonable. If someone wanted to go up a lot of cup sizes, I wouldn't say that's your first line to do fat transfer, because there's only a certain amount you can put in at a given time and expect it to survive. So if you overload the body and put more fat than that blood supply can handle, part of it's going to get resorbed. So, and sometimes patients, I think, confuse a little of the swelling with the fat and think it went away, but it's normal to have swelling come and go, and then that is your result. It's not the swollen phase, is not the end result. But say if you want it to be fuller, you could do it in more than one step and gradually build up the breast volume.